And for paucity of time, we'll go on to the next speaker. It's my pleasure to invite Dr. Pooja Khamar, who's a senior consultant in Narayan Netralaya and who's doing a lot of cutting-edge research work at NN to speak on gene therapy in refractive surgery. All I know about genes is to select the right partner so that your children don't wear glasses. But she's going to tell us more.
Thank you, sir. Thank you. At the outset, I would like to thank AIOS, Kudlu sir, and the entire refractive surgery committee for having me here. So I'm going to be very quick and just tell you right to the point how it's going to be useful in future. So this is something which is lysyl oxidase. Lysyl oxidase is something which holds your corneal stromal collagen into place. But if the lysyl oxidase, the purple dots, what you see, it's on the lower side, the collagen starts slipping away. And that's when you develop ectasia or keratoconus. And if it's on the lower side, your keratoconus disease starts progressing. And if it's a refractive surgery patient, it can develop ectasia after your surgery. So this is what you have to keep in mind is why lysyl oxidase is important. So we have proven with multiple publications and research projects where if the lysyl oxidase levels are lower, the keratoconus disease keeps progressing. And also after cross-linking also, you have cross-linking, but the cross-linking effect can fail because of the lower lysyl oxidase levels. And we were the first one to report that post-SMILE surgery, a patient with normal topography and biomechanics underwent SMILE, but after SMILE surgery, patient developed ectasia. So if patients developed ectasia in LASIK, we cannot evaluate why it happened. But in SMILE, we had the lenticule, and it did show that the patients had lower levels of lysyl oxidase and collagens to begin with. So the question here is, can we modify this lysyl oxidase gene with the gene therapy in corneal ectatic disorders? So we at NN have developed a class 100 facility where we can develop our own vectors which can be used for gene editing or gene therapy. Now, gene editing is nothing but it removes a defective gene and it replaces it with a normal gene. That is what gene editing is, and that's where the AE vectors come into play. Now, there can be different modes. There can be topical drops, there can be intrastromal injections, intracameral injections, or subconjunctival injections. But we wanted to study that whether the topical drops or intrastromal injections can help in modifying this lysyl oxidase gene or enzyme. So we did a lot of studies on animal model and lenticule where we injected the lysyl oxidase vectors. Just to simplify, what we found was that if you inject this lysyl oxidase vectors intrastromally or as a topical drop format, your lysyl oxidase levels here, you can see in this graph, do increase compared to that of controls. And your collagen, which is also necessary to maintain the strength of the eye, also increases. But more interestingly, what happens is the inflammation. Inflammation is always higher, and it is responsible for keratoconus disease and the progression of disease, or it's also involved in ectatic conditions. So if you can control the inflammation, you are halfway through. So lysyl oxidase therapy just not only increases the lysyl oxidase levels and the collagen levels, but it reduces the inflammation also. And we found this results consistently in human donor corneal lenticules, the human corneal mouse model. So next what we did was we want to start this therapy with, of course, DCGI approval and regulatory approvals on patients. So before that, we had to have the right technique of how to use this lysyl oxidase vectors and how to inject them. So we create these pockets using IFS. You can also use other technologies to create pockets like how you use for Intax channel. You open them and then you inject the vectors into this wound and then you seal them. What we are seeing early results is that you can see here how the gap is. That means the collagen and the lysyl oxidase is on the lower side. And when you inject these vectors, they start becoming tighter with one therapy. And not just the collagen and the lysyl oxidase starts becoming tighter, the strength of the cornea also increases when you inject this lysyl oxidase vectors. So the future is, of course, as refractive surgeons, you have to do refractive surgery. You cannot prevent ectasias. But if you know that your lysyl oxidase or the collagen levels are on the lower side, or if your patients do develop ectasias after that, lysyl oxidase therapy, a gene-based therapy, would be a potential treatment modality for these patients and for keratoconus patients as well. We have already published this gene therapy guidelines for India. So it will be soon coming to India with a Make in India product. So it will be cost effective for the patients as well. Thank you.
Yeah, Pooja, I have a straightforward question.
Yes, sir.
Can this replace Smile Extra?
Sir, that would be a path forward. At this point of time, we do believe it will. So you'll just have to use drops in topical format, but it will need at least 5 to 7 years of work before we can say that.
The
And
second
can it-
question would be just offhand, if it's going to be a drop therapy, why not use this for every patient after every refractive surgery?
So because it can have a negative effect also. If your lysyl oxidase and collagen are optimal, and if you put them, your refractive surgery, any surgery do, especially your smile extras and PRKs, they will land up into scarring and haze. So scarring and haze post-surgery. So you have to have it in an optimal level. So only if it's on the lesser side, you probably would do it.
Can you prevent progression of keratoconus with this?
Yes, ma'am. That's the idea.
So thank you, Dr. Pooja. Narayan Netralaya has always been at the forefront of cutting-edge technology and contributing a lot to the development. So
Thank you, ma'am.